Hello, everyone. Today we're going to talk about something important, dental health. It's something that matters to all of us. I'm Fatima, and I'm excited to be your host for this live show. We've got a great show lined up. We'll be talking with Dr. Kumar Vadivel, also known as Dr. V. He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep your teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in the dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask live questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain type of dental care. He works at ToothHQ Specialists in the Dallas-Fort Worth area here in Texas, and guess what? He's even writing a book that comes out next year. If you want to know more about Dr. V, check out our website at www.mytoothhq.com. So let's get comfortable, relaxed, and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome, everyone. And now let's welcome Dr. V to the show.
Thank you, ma'am.
You're
Thank you
welcome.
very much. Hello, everyone. I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm really excited to be here with you all today. Again, another great show lined up. Let me tell you a little bit about myself. Although Ms. Fatima had a great introduction for me, I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bone that surround your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and the American Board of Periodontology. That is a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists over 3 decades ago almost, and we have 4 offices in the Dallas-Fort Worth area. We are all about making sure that your teeth and gums are healthy and strong. Now, I'm here for you, and I would love to hear any questions you may have about your teeth and gums and implants and anything that you can think of. You can ask questions here live right now, or send us your questions and for our next show. Your questions really help us make these shows really helpful, not just for you, everyone, not just around in the US and everyone around the globe. And one more thing, if you like what you're learning here, please let us know. Ms. Fatima needs kudos, and me too.
Yeah.
Your feedback is super important to us, and don't forget to like and subscribe to our channel so you won't miss out on the latest and greatest updates and any helpful tips for your dental health. I'm so looking forward to talking with you all tonight and answering any questions you may have. And let's make our smiles as great they can be, right?
Yes, right.
Awesome. Very good.
We have a lot of good questions lined up today. You guys sent in some really good questions. All right, so we're just going to jump right in. Our first question is, Doctor, how can I brush my teeth effectively if I have trouble holding my toothbrush steady?
So this is one of the most common things that we talk about. So the handle is very critical when you're holding a toothbrush. Switch to an electric toothbrush because larger handles are of the power toothbrushes. You may be able to hold it better as compared to like a regular small toothbrush. Use adaptive grips, like we call it, as like there are some grips available so you can put it on, like it's almost like holding a soda can and you put like a grip over up on the top or like a cooler over up on the top to hold it better. And try a different type of or a different brand of toothbrush, and which may be better because sometimes depending on the brand or the specific type of toothbrush that you buy, and the handle sizes may be different. And I usually say, hey, walk down the aisle of your favorite departmental store or your favorite drugstore, and just like try out which one feels better in your hand. And then a lot of people, like what they do is like they just lean on the sink to stabilize their hands, and then do the brushing. And I'm not saying I'm or advocating, oh, you just scrub, don't do that. You kind of want to go in a gentle motion, just kind of circular motion. And on the top of that, like use some rinses or any other oral hygiene techniques you believe like it could really help you. And definitely do not forget the flossing, which is very, very critical. And then if you have a bunch of toothbrushes that you are wanting to try out, or when you go for your hygiene visit the next time, ask your hygienist or your dentist. And hygienists are great people and giving you some helpful tips on the best oral hygiene practices. So talk to them next time when you're there for the next cleaning, and they should be able to help you.
Yeah. All right. Our next question is, do wisdom teeth always come in crooked, or do they grow in perfectly straight? That's a good question.
So, do wisdom teeth always grow in crooked? Not always. So, we got people like they come in, then it is possible that your tooth may completely come in normally, totally fine. And of course, the jaw size matters. And then, although the jaw size matters, most of the time these wisdom teeth are coming in crooked. Whether you have a small, like you got like some big guys in the family or big people in the family, 6-footers, or you have a lot of people that are there petite. It doesn't matter. So you may still have either completely erupted teeth or completely crooked teeth. When they are crooked, and we call these teeth impacted, when they are impacted, they are going to cause a lot of issues like gum issues and cavities and misalignments of your teeth and misalignment of your jaw. So whether it is crooked or whether they are perfectly straight, and make sure that you are going to get them checked out with your dentist, and whether they are causing any problems, and that is what is critical, and whether they are straight or whether they are crooked or not. So get it checked out with your dentist when you go next time.
Yeah, because they can be painful.
Absolutely, yeah. That is what we do all the time. So you happen to be in the Dallas-Fort Worth area, come see us, and we'll be happy to take care of them for you. And check them out,
Yeah.
And what do we do in the office? The CBCT scan, right?
Yep.
Yeah, absolutely. So we do a CT scan to check the position, and some people, they don't even know the wisdom teeth are out or not. So we do the x-rays, and so they're completely impacted under the gum line, and we'll be happy to find out through the x-rays. Yeah.
Yep. And Dr. V, he can take a wisdom tooth out in his sleep, so you won't even be in here that long.
Thank you. Yeah.
He's so fast and efficient with it. So yes, make sure you guys check him out.
Thank you.
Our next question is, how likely is it for dental sealants on upper molars to fail due to normal wear and tear?
Normal wear and tear can absolutely make these sealants kind of chip or wear down or completely detach from chewing. Success rate really depends on, normally they are supposed to be staying for like a year or two, because they need to be replaced, and they're not supposed to be. They're not like a filling. They are just kind of sealing the grooves or the early cavities, or sometimes we call it as incipient lesion. So we kind of seal them, right? And we normally put these sealants on kids. Like several years later, you still see them, and you put these sealants, and they are gone. The long-term survival depends really on maybe 5 years, and maybe about 50% of the people keep them for 5 years. A lot of factors depending on your chewing forces, your grinding habits, your oral hygiene, the type of sealants used, and your brushing habits, and a lot of these, these factors depend on that. To prevent these from going bad or prevent them from falling out, get your regular checkup. So you can't put the sealant and then forget it. You still got to go back for your routine dental cleanings, which is every 6 months. And So if they have fallen out, then they can always reapply it or repair it before the cavity develops. And the overall benefit is that you make sure that the sealants generally stay put. Either they are staying on their own or your dentist is going to reapply. It is going to prevent the cavities, and compared to like an unsealed tooth with a lot of grooves, and the sealants are going to really help you prevent the cavities, which is an easy thing to do as opposed to a treatment. You are going to be more of preventing.
So preventing it. That's good to know. All right, guys. Our next question is, are my jaw clicking or popping noises related to my headaches?
Absolutely. The popping noises could be related to your headache. We generally call it as a TMJ, or a temporomandibular joint, a TMJ, temporomandibular joint, or we call it TMD, temporomandibular joint disorder, temporomandibular joint disorder, TMD. So both of these are absolutely, or most commonly related to your headache, because when you have TMJ, that causes the popping noises, and this popping noise, again, always is, or most commonly, it is related to your headache. Sometimes even if it is may not be like a headache, complete headache, it could be from a possible muscle that is here, like which is holding your joint together. So whenever you open and close, these muscles are kind of like working, and when you constantly keep grinding or clenching your teeth, and you are overworking those muscles, and these muscle strains, sometimes can be construed as the headache. So make sure that you're not grinding or clenching. If you clench or grind at night, it really puts a lot of stress in the joint, worsening the popping, thereby worsening your headache. Other symptoms that you got to be really watching for are any kind of a jaw pain, not necessarily the popping, any kind of a jaw pain, sometimes even ear pain, or like your ears kind of feel full, and then a limited mouth opening. People cannot open their mouth wide, so that means like you got either some jaw popping or some kind of a strain in the jaw, or like in the muscles. And sometimes the clicking, sometimes we say, could be harmless, although over a period of time that can lead into some kind of a popping. So the best thing is ask your dentist whether it is possible that the clicking or the popping could be damaging to your joint or not, and whether they see some patterns of you clenching or grinding your teeth or not. Sometimes what we do is like we take molds. Like nowadays it's very easy. We scan your mouth, and you can possibly even take a picture of your mouth and compare whether you are starting to see some kind of a wear on your teeth or not. So it is a very common thing to do. So once you go to the dentist, we scan and we can compare over a period of time whether you're grinding or clenching your teeth. There are a lot of treatment options if you find out whether you have clenching or grinding or any type of these popping or not. You can get a night guard. You can get a night guard from the dentist, although it is not uncommon for people to ask me, oh, can I get one over the counter? A lot of times you are going to end up doing some damage by getting the night guard. And in my case, I'm a periodontist, meaning like I take care of the gums. So a lot of time people are thinking about these night guards only causing damage to the teeth, but a lot of time they do not understand it could be by wearing them, they are going to constantly keep rubbing on the gums. They can actually cause some damage to the gums. So make sure the bite guards that you're going to wear are custom ones, or if you're going to end up getting something over the counter, take it to your dentist and check with them to make sure they are safe to wear. Do some jaw exercises, get some stress reduction protocols, and do some yoga, and maybe get some physical therapy. So a lot of these things can help with your clicking and popping noises, which are related to the headache.
I'll be getting headaches. I'm a grinder at night though when I sleep, and then I can like I know when I'm clenching my teeth, but I didn't know that they go hand in hand with the headaches. I didn't know that. So I learned something new today. Thank you for that question.
Absolutely.
All right. It says, Doctor, is it still possible for me to have a successful dental implant at 70?
Absolutely. We call age no bar, right? Absolutely. Age is no bar for anything and everything that we do. Over a period of time, like, being in practice for over 3 decades, and I have patients, I can vividly think of last week we had a patient, 94-year-old lady. She had a missing tooth on the top left. That tooth, which was an anchoring tooth to the partial she has been wearing for the longest time, and she didn't need dental implants for the last 20 plus years that she has been wearing this partial, which is holding absolutely fine. However, now that anchoring tooth on the back that completely broke. So guess what we are going to be doing? So we removed that anchoring tooth which completely broke. We did a bone grafting because we could not place the implant at the same time. So we will be placing that implant in about 3 to 6 months over after she completely heals. My oldest implant patient is 106. Same thing. We had to place an implant to anchor a partial. My another oldest implant patient is 86 years old. Guess what? She was getting married at 86 years old, and she wanted to have good looking teeth and for holding her denture, and she did not want those dentures to be popping out when she was smiling for her wedding pictures, and she did not want her spouse to know that she will be removing her teeth and she want them to be fixed. So we ended up doing some implants to anchor her dentures. So speaking of that, age doesn't matter. More than that, health is what matters. So your overall health is connected to having healthy teeth. So get some good teeth and dental implants irrespective of your age. Bone density to an extent matters as compared to the age. And if you have good bone, irrespective of your age, and it does not matter, you can still have dental implants. The problem that we see is commonly when people get older, they get like a lot of comorbidities, what we call it as, or medical conditions like diabetes and osteoporosis, and people have other conditions that are going to affect their mouth on a lot of medications and dry mouth and all of that. And people are also going to be smoking. These are kind of going to be relative contraindications, although they are not like a true contraindication. Despite having those medical conditions or could be smoking, you could still get the dental implants. Speaking of the benefits of why you should be considering dental implants even at your age of 70, better chewing, improved speech, and preserve your facial structure so you don't have to worry about aging. And it could often be life-changing, for seniors. So do not worry about your age. Get the dental implants. Go to your dentist, go to your periodontist, go to an oral surgeon, and talk about the implants and how they can benefit you.
And don't worry about your age.
Absolutely, yeah.
Well, we have some live questions. All right. So our first live question is, why do dentists use a hook when they're examining teeth?
Do you know what a hook is?
It's the Explorer. It's called an Explorer.
Thank you. That is exactly what I was going to say. Man, I should have bought a hook here. Okay. So if it was not a live question, I would have probably bought a hook here. So what a hook means, like it is like what Fatima said as an explorer. Sometime, I call it as my thinking stick. I cannot think without, and because sometimes people get scared when I see that hook, when they see the hook, and I tell them, hey, I promise I'm not going to hurt you, but this is my thinking stick and I cannot think without. I'm joking, but I'm just saying, I joke with people when they get scared, I'll call them as a thinking stick. So hook is an explorer, and we use to sometimes the hook has two ends. Either one end with like a hook, or one end has a hook and then the other one has a probe in the end. The hook end is called an explorer, and the other end we call it as a probe, which has a measuring ruler. So we use the hook to feel the surface of the teeth and whether there is any catchy areas on the tooth, to see whether there is any cavity. If there is any catchy points, then we are also using the hook to see whether those catchy areas, like the areas that get caught on our explorer, whether they are hard or soft. Sometimes we are able to use that to kind of go into those the areas that catch on our explorer to see whether they are soft or hard. Depending on that, we can say whether there is a possibility that this area could be like a possible cavity starting, or maybe a cavity that has already started. The other end of the explorer, we call it as a probe that we use to measure whether you have any gum disease, an indication of the gum disease, whether you have pocketing or the bone loss. So that's what the explorer is. Yeah.
So instead of a hook,
Yeah.
it's called an explorer.
Oh yeah, thank you. Yeah.
All right. So our next question is, I've noticed that when I skip breakfast, my breath smells worse. Is there a connection between skipping meals and bad breath?
Absolutely, there is a great connection between skipping breakfast or skipping any meals, or people nowadays, so people, it's very common for people to be doing intermittent fasting, and so when you go for fasting for a longer period of time, so it is absolutely not uncommon for your breath to stink. Skipping meals reduces saliva flow, leading to what we call it as a morning breath, particularly if you're skipping breakfast and that lingers longer. Saliva plays a big role because it washes away food particles and bacteria, and less saliva means because there is no food, and more odor causing bacteria and buildup that causes your breath to stink. Empty food effect, when you don't eat and there is a lot of stomach acids that causes a lot of gas to contribute, and that come into the mouth to cause an unpleasant odor. We call it as a ketone breath or like a ketonic breath. So it is very possible. Bacterial activity. So when you have bacteria that break down when you have not eaten the food for a long time, and these breakdown products and sometimes from protein on your tongue and the gums, and they release like a lot of sulfur, which is nothing but like the bad breath, and that is exactly what causes the bad breath. So what do you do to prevent this? So make sure that you are keeping yourself hydrated. Not drinking enough water will cause this bad breath, or even may worsen your bad breath. Quick fix for that is, instead of skipping long meals and just maybe eat a light breakfast and stay hydrated and brush your tongue if you are more prone to getting a bad breath. So make sure that you are going to brush your tongue. I recommend using even the toothbrush to brush your tongue, or you can use some tongue scrapers or tongue cleaners to brush your tongue. Long term, if you had bad breath despite having meals and hygiene, and it is very possible that you may have, or you may be suffering from gum disease or bad cavities or some teeth going bad, or you may have some medical issues, or you may be taking some medications that are causing the bad breath from the dry mouth. So check with your dentist and see whether there is anything that you need to be concerned of.
Yep. I like the tongue scraper. The toothbrush, it makes it feel like raw almost if you scrub it too hard, but the tongue scraper is my favorite.
Awesome. Yeah.
And it helps when you have like a weird taste in your mouth. It just takes it away.
Absolutely. Yeah. Mm-hmm.
Our next question is, how can I whiten my teeth if they're sensitive? Are there special products for people like me?
There are several options exist, right? Just because you got sensitive teeth, you don't have to stay away from whitening your teeth, and if that is what your goal is, then you absolutely want to get your teeth whitened even though they may be sensitive. What you can do is you can try applying or using some desensitizing toothpaste to combat the sensitivity before you apply the whitening product, whatever the whitening product, either the strip or the whitening toothpaste that you may be using. So use it along with. So instead of using a regular toothpaste, use a sensitizing toothpaste. Now you're using the whitening product. If the teeth become sensitive, now you're going to continue with your desensitizing toothpaste, which is going to help you with the sensitivity. Lot of professionally graded whitening products. For example, nowadays we use laser to do the whitening. So it is just as simple as passing some light onto your teeth to whiten your teeth. So it is very safe. It could be a safe option irrespective of whether you have sensitive teeth or not. Most of the time I see why the sensitivity happens is because of the overuse of the whitening, because people want to go crazy on whitening from 1 or 2 or 3 shades, and it is not going to happen overnight if you are going to be using it some over-the-counter products. So make sure that you go slow, and then do not keep using it prolonged, particularly if you have any sensitivity of your teeth. As I said, alternative methods are laser whitening, and sometimes we use custom tray to give you the whitening, and then we kind of like titrate the gel, or the strength of the gel depending on your sensitivity. And if you are having any of the issues, take extra precautions such as using soft toothbrushes, avoiding acidic foods, and rinsing with the fluoride mouthwash, and continued usage of the anti-sensitivity toothpaste. So all of these things combination would help, really help.
Yep. This question is interesting. Could my oral health be the reason I've been having trouble swallowing and occasionally choking on my food?
Absolutely. This is not an uncommon thing people ask. It's not to happen for people. One of the most common reasons why people choke, because they are not chewing their food properly. So they are kind of swallowing in big pieces. When you swallow in big pieces, irrespective of your age, you can still choke. It's the same thing happens when people get older, or when people have missing teeth and they are not chewing their food properly. Now they are swallowing it fully. Then that's exactly what happens, and that causes the risk of choking. And why do people have trouble in chewing? People have gum disease, cavities, poor fitting dentures, or they have no teeth, and these are all things that can affect your ability to chew properly, which is going to lead to poor swallowing. And additionally, people have dry mouth, infection, and pus pockets, and they don't feel comfortable, or they got severe pain. They don't feel comfortable chewing properly. So it is always a good idea to go see the dentist, identify the source of the problem, and whether your oral health or potential conditions that you have in your mouth, how they are affecting your mouth and thereby affecting your swallowing. And dentists can give you the recommendations, and definitely refer you to the specialist if required. In my case, if you go to the dentist and if they find out you got some missing teeth, and they are going to send you to me to get some dental implants, and we are going to work with your dentist to get the teeth replacement. If you have a poor fitting partial denture, or you have severe gum disease and they are not able to help you at your dental office, and they are going to send you to a periodontist like me to get you checked out. So bottom line, get it checked out, and poor teeth can lead to swallowing issues.
Yes. We are about to do the rapid fire questions. I like these because he can't answer them in a whole bunch of sentences. Just
What did you
one
say?
or two.
What do you mean?
You can't.
I can't fumble.
No,
you're
you
saying.
can't. Yeah.
I
You
can't
can't
fumble.
fumble.
Oh man. Okay. I'm
So-
gonna get ready. Let me take a deep breath. I'm gonna take a deep breath now.
Okay. All right.
All
So
right.
we're gonna start at
Yeah,
number
Can you
5.
say please ready?
Okay. All right. You ready?
Okay.
Okay.
I'm
Okay.
ready.
All right. What are 5 ways to reduce the risk of developing a dry socket?
Avoid smoking. Follow the extraction instructions given by a great dentist like Fatima. Keep the extraction site clean. Eat soft food for a few days and use ice packs to reduce the swelling
Yep.
or prevent dry socket.
Yep. And no straws. No straws.
You got it. See, you're
No
exceeding
straws.
now, not me. Yeah.
All right. Next one is, what are 4 easy methods to recover from dental numbness faster?
Gently massage the numb area. Move your teeth and lips to stimulate the circulation. Drink lukewarm beverages and wait for the anesthesia to wear off naturally.
You did that one good. That one was good. Okay. All right. The next one is, what are 3 simple steps to prevent gum disease while pregnant?
Brush and floss regularly. Attend your routine dental checkups despite being pregnant. And eat a balanced diet and stay hydrated.
All right. All right. What are 2 signs that can help you distinguish between a lesion and oral cancer?
Persistent pain and tenderness and unexplained changes in the size, color, or texture of any parts of your mouth.
Okay. All right. If you had to choose between a manual or electric toothbrush, which one would you pick?
Electric toothbrushes, in my opinion, are generally more effective at removing plaque, but proper technique with the manual toothbrush can also work well. Personally, I use a electric toothbrush.
Okay. I use a regular toothbrush. I'll have to try an electric toothbrush though.
Absolutely, they're great. Yeah, absolutely great. Yeah, tools. Yeah.
You did really good. You
Thank
answered
you.
them in a good, timely manner.
Okay,
So thank you
great.
for that.
Yeah.
All right. So we're going to go back to our regular questions. Dr. V, what is your thoughts on the all-on-4 dental procedure overseas?
Man, this is one of the most common questions. We get asked. Hey, it is expensive to get dental treatment done. Can I go overseas to get it done? Of course, we are in Texas, and so people just go across the border to Mexico to get a lot of dental work done. And Dallas is a multi-ethnic city, so people go to all sort of countries to get the work done and get the work done overseas. The challenge, let me back up here. If you're getting a filling done or an extraction done or a cleaning or a deep cleaning done, these are all okay because they are a one-time done procedure. But if you are getting an all-on-4 procedure done for cost savings, of course it can be significantly cheaper, sometimes half the cost or maybe even less. But are they as high quality as compared to? I can't really promise they are not going to be as good of a quality when compared to the standards that we have in the US, because it is all regulated. The dental industry is regulated, and depending on which country you are going to, if they are not regulated by the government, which we are regulated here, then you may end up not getting the standard quality that you are going to get. What are the complications here? Post-treatment complications are very hard to manage, and when you are going to get the work done abroad, what if there is a complication? One of the tooth breaks, and are you going to take a flight and go there? And hidden cost of, sometimes people do not understand, it is not the first time that you're going to pay for the travel, the flight, and the accommodation, and the potential follow-up procedure. If something were to happen, if it were the all-on-4 prosthesis breaks or you get an infection around the implant, you're going to pay for it again. What about the legal and the communication barriers? And if you are going to pay for it here in the country, as we are bound by the legal and the malpractice and all of that, and so you have authorities that you are going to control even a dental practice or a practitioner, so you don't have that when you have it done overseas. So all in all, while it is affordable, it is essential. You need to do your research, and you got to check out your clinics thoroughly and consider potential follow-ups and potential challenges you may have in your specific condition. I'm not going to generalize all on four procedures are risky to get overseas. What if you have medical complication? Your risk is going to go even higher. And also, this is the one most critical thing that I'm going to say. Implants are region specific. Even within the United States, we have East Coast doing certain type of implants, Midwest does certain type of implants, and then the West Coast type the certain type of implant. So all across the world, we got about thousands of FDA approved implants, and they are being done overseas. So some of these FDA approved implants, when I say FDA approved, they are not common in the United States, and they are not being done. Not everybody uses them, irrespective of whichever course that you are in. So when you are going to get a certain type of implant that is mostly common in only that particular country that you are visiting, guess what? When you come to the United States back, we may not have that exact tool to be able to repair or properly take care of the implant. So again, going back to irrespective of the affordability, make sure that you are going to research and consider all of these factors before getting these all-on-floor procedures done overseas.
It's very important to do your research. Do your research. All right, guys. Our next question. Now, you might have to help me pronounce this word. It said, I took
Tetracycline.
Okay.
Yeah.
In the past, could it be the reason my teeth have brown stains? What is that?
Did you have acne when you were a kiddo?
I did.
Yeah.
I think I still have acne sometimes too.
It's true, but mostly like when you're a teenager,
Yeah.
right? You know, so when you have acne, tetracycline is one of the most common drugs the doctors give you.
Oh.
Yeah, so absolutely. Past tetracycline can cause brown or gray stains on your teeth. Sometimes, even when we extract the teeth and we find out like, hey, these tetracycline damaged your root of the teeth. So it is very possible that you may have some type of damage that happens from the tetracycline. The treatment can be very simple. Treatment include professional teeth whitening, or depending on if it is a very mild damage, like you may be able to get away with some over-the-counter, although it is not possible. We can fix them with veneers, dental bonding, and depending on the severity of the discoloration, your dentist should be able to give you the recommendation.
So it's not permanent. I mean, it could be fixed.
It could be fixed.
Okay.
It is permanent because it has already happened, because it happened during your growth phase, right?
Yeah.
But it is not something that you cannot fix it. It is very fixable.
Okay. All right. Okay, so our next question is, if I accidentally eat something hard while healing from laser treatment, will it affect my recovery?
Yes, it can affect. Hard food, as a matter of fact, which we do not recommend you chew, will disturb the healing gum tissue, and it will slow down your recovery. The way the gum, the gum and the bone heal around the laser treatment tooth is after we do the gum treatment using the laser. We use the laser to kind of seal the gum to the tooth. So if you think about it, like if this is the tooth, then if this is the gum, so whenever we do the gum procedure, we do the procedure between the tooth and the gum, and then once we finish the procedure, we induce some bleeding around between the tooth and the gum to kind of seal it. So now the gum is stuck around the tooth using that blood clot. So when you start to chew hard foods, you break that blood clot similar to the dry socket.
Yeah.
So when you separate the gum tissue, now there is no more sealing, and that is what is going to affect your recovery, or the regeneration, or the stimulation of the new bone and the gum tissue and all of that. So when you have that risk of irritation from the crunchy or the sharp food, it can irritate and reopen the treated areas. Healing is very, very fragile, particularly the first 1 or 2 weeks. Gums are, like I call it, as a baby gums, and they are still forming, and so those baby gums, still are forming a protective seal that you got to really, really be careful of. And you may have some kind of like a side effects from these this laser treatment because of increased sensitivity. You may have mild bleeding or delayed bleeding, but don't worry about it. Still do not chew, which we may be causing by even from soft chewing, but particularly if you are going to do hard chewing, then it is going to cause all sort of things. And if it is a one-time accident, if you accidentally chew just one time, you don't need to worry, like things happen. But if you don't want to continuously be chewing hard food, which is going to may cause some pain or a bleeding, or repeated mistake can harm the results or the recovery period, or the outcome of your laser procedure. The best practice is to stick with some soft food, soups, yogurts, egg, mashed potato, Jello, as advised by your dental office. And when you come to ToothHQ, we give you like a complete list of soft diet. So you are going to go home with a complete list of recommendations and what you can eat, including some ethnic choices we give you guys. And what if it happens, right? And if you accidentally just did something, rinse gently with the lukewarm water, and use the mouthwash given by the dentist, and ease the discomfort. If the pain continues to be there, contact your dentist or the periodontist for any type of pain or swelling or any bleeding that you may be concerned of. Yeah.
So kind of like when you get an extraction, almost. It's some of the
Absolutely,
same
pretty
things.
much, yeah. A lot of them, well, we use the same instruction sheet, right? The post-instruction sheet, except that we tell them, hey, absolutely no chewing at all for 2 weeks. And particularly if you're getting if you're getting the side, one side done, no chewing at all. And the other side, like if you're getting a full mouth, absolutely no chewing on either side. Sometimes, particularly one of the type of procedure that we do, what we call it as a LANAP procedure, we do not even recommend brushing your teeth, because just by mere brushing, you're going to break that seal open. And this is exactly what I say, so hey, I'm going to ask you to not brush your teeth for 2 weeks, and you're going to feel like your teeth feel yucky by, sometimes it just feels creepy not brushing your teeth, right? So I tell them, hey, it is going to feel weird, and it is going to feel creepy, and it is going to sound strange. A dentist is asking you to not brush your teeth for 2 weeks. Do not worry about it. Use the mouthwash that we are going to give you. Even the mouthwash that we don't recommend, you do that. Don't do it vigorously, because that is going to even dislodge the blood clots. So what I normally do is particularly the chlorhexidine mouthwash that we dispense from our office after any type of a laser procedure. It kind of sticks to your gum tissue. That's the way it works. So what I generally tell people, or my patient, get the mouthwash, hold it like this for like a minute, and then spit it out. And you do that after each meal, and after each snack, even after you brush and before you go to bed. So do all sort of things in addition to not eat something hard, to recover the best from the laser procedure.
We have another live question. I like the live questions, guys.
Yeah. Okay.
All right. So our next live question is, Dr. Vadivel, What is the best material for bone grafting and dental procedures, and what factors should be considered when choosing the material?
There are so many materials available for the dental bone grafting. If you think about the brand names, I'm not going to get into the detail. The material that we are available are, we call it as an autogenous bone graft, which means like it comes from your own body, or like a non-autogenous, which means like it comes from somewhere else. So on the non-autogenous, which means it can come from either from cadavers, we call it as an allograft, or we call it the one that comes from either the cow or from the horses, we call it as the xenograft. Sorry, the cow is called like equine graft. The cow bone is called the xenograft. And then we also have some synthetic materials. It always happens in our office, right? Whenever I come for a live show, I come up with something like I'm really bringing something fresh. This afternoon, I was in my Dallas office. The patient has some strong religious beliefs, and he cannot get any type of an allograft, which means it comes from the cadaver, or like a xenograft, which comes from the cows. So he was asking for some synthetic material. So I had to use a synthetic material for this particular patient. So going back to your answer, what type of bone grafting is the best? So depending on the situation, we end up using a different type of bone graft, and then depending on the type of defect, we will end up using a different type of bone graft, and depending on what your dentist believes in. So the dentist may not be comfortable with using a different type of bone graft, and they are trained in a certain type of bone graft, and depending on the region that you are in, depending on the country that you live in, one bone graft may be popular than the other. And then this is what we study in medicine, and we kind of like as surgeons, and we use a lot of bone graft as compared to the dentist. And so in the meetings that we talk, like, hey man, what's your cocktail? Right? So cocktail, man, we are not talking about drinking here. We are talking about, hey, what do you put on in your bone graft? Hey, do you use the allograft, or you mix it with the xenograft, or you mix it with some synthetic material, or you add some antibiotic to it, or you add some growth factor to it. So simple answer your question, there is no such thing as what is the best for your what is the best bone graft. It really depends on your condition, depends on your surgeon, depending on the place that you are in. So multifactorial question. So talk to your dentist or your periodontist or your surgeon. They should be able to answer your questions for you.
All right. We have our last live question. This one says, Doctor, does wearing dental jewelry weaken teeth in any way?
Absolutely. So this is one of the most common things that I see. Women are pretty, men are pretty with jewelry, but not with dental jewelry, in my opinion. The biggest challenge that I see is when you're wearing a jewelry like just that does not come close to your teeth or the gums. I'm okay with that. But the challenge is you do not see the damage it is creating either on the inside of your outside, meaning like let's say you're wearing a lip jewelry here. What is it causing inside here? You don't know. And what if you are using a tongue jewelry here? What kind of damage it is causing on the inside of your teeth? This is one of the problems that I see, because when the jewelry constantly moves, look at that. If I keep constantly pushing, then it is going to damage the inside of my bottom front teeth. And if it is a jewelry, then it is going to constantly keep hitting, and it is going to completely make your tooth kind of even dent, and your gums kind of completely pull away, which is one of the most common things that I see, the gum receding. And when you wear jewelry, then you don't keep your teeth clean because it's constantly kind of hitting against the tooth or sitting on the tooth, and you end up leaving a lot of tartar and plaque, and then the teeth are going to fall out in addition to the gum receding. When you wear like a lip jewelry, for example, and you end up, whenever you're talking, and you're going to end up hitting the tooth, and it is going to cause a dent on the tooth or cavity on the tooth and cause a lot of gum damage. So you heard me right.
Yeah, I heard you.
Absolutely, yes.
And
yeah.
he is true, because I had a lip piercing and it kept hitting, and it was like making the gum like real sore in that area, so I had to take it out. But I never thought, you learn something new every day.
Absolutely, yes.
All right, our next question is, are my chances of developing cavities or gum disease higher during pregnancy?
Absolutely. You got so much of hormonal flow during pregnancy, and it increases, your risk like anything else because of the hormonal changes and affecting your gum health and in oral health. We call something, what we call it as a pregnancy gingivitis, because you have increased estrogen and increased progesterone and all of these, the pregnancy hormones. It makes your gums kind of really sensitive, swollen, and it more prone to bleeding. And then your cavity risk increases because of your morning sickness, and then you end up throwing all the time, and it brings the acid inside your mouth and acid reflux, and then you're eating all the time for you or your baby. You're hungry, a lot of sugar intake, and frequency of snacking exposure increases your exposure to acid more, and then sugar, and that puts you at risk for cavities. So your gum disease risk goes high, and your cavity risk goes high. And sometimes people end up having a tendency to skip your dentist, and I do not recommend you skip your dentist even though you're pregnant, irrespective of your wherever you are. Maybe on the first couple of weeks, and when you become pregnant, you can avoid the dentist. But as soon as you become pregnant, make sure that you are going to get your cleaning done. And one most common thing people do not know is, in addition to these risk of cavities and gum disease, the gum disease risk carries into your baby also. It causes a lot of pregnancy issues. It causes premature babies. It causes preterm labor, low birth weight, which are one of the most common things that people do not know. So make sure that it is not only the dental risk or the gum risk, but also you're causing a lot of risk for your pregnancy also.
Yes. So make sure you still go see the dentist
when you're pregnant.
When you're pregnant.
Throughout your pregnancy. Absolutely. Yeah. Right. Yeah.
All right. Our next question is, are imaging tests like MRI always needed to diagnose TMJ, or can it be diagnosed through a clinical exam alone?
Dentistry, we do not diagnose just by clinical exam alone. At least we want to justify our findings along with imaging. But can you diagnose, or can you partially diagnose a TMJ condition? Obviously, yeah. When your jaw pops up, it is because of the joint. When you have a complete joint pain, more than likely, and it is possibly because of the TMJ, or the temporomandibular joint, or TMD, the temporomandibular disorder we call it. However, we need to get some kind of a baseline, because what if you are somebody, your TMJ is going to get worse over a period of time. So then we got some baseline that we can compare it to. So while the clinical exam is going to help, and although we can diagnose it initially through the clinical exam, and which includes we are going to check for the pain and the clicking and the limited movement of your joint, but we always need some kind of an imaging. So most of the dental offices, we do what we call it as a panoramic x-ray or a CBCT, which is going to show some kind of a damage that happens in the joint. But do you really need an MRI? Possibly not, unless your condition is kind of advanced, and particularly if you're in the United States and if you're going to be using your benefits, and the MRI exam may or may not be covered by your benefits. So in that case, we have to think about helping you as well. And so you really don't need an MRI unless it is an advanced condition. So the way it goes is we do a clinical exam, we do like a panoramic or a CBCT, diagnose your condition, and then we do some conservative treatment. And then if that conservative treatment does not help, then if you needed to really go see like an advanced, like a TMJ specialist, or we call it as a TMJ dentist, in those cases, again, as you go, we will be sending a copy of whatever the imaging that we have. In that case, and if they think that you're really going to need like an MRI, they are going to order. Particularly if you have any symptoms that are going to persist or they are going to get worse. And this imaging is going to really help assess really what is your joint structure and then rule out any other conditions.
So basically, the MRI and the X-rays basically see what the eye can't see.
You got it.
Okay.
You got it.
All right.
Yeah.
I think we have time for one more question, guys. All right. So our last question for the night is: my husband had two teeth extracted 3 months ago and paid in full at the office with no insurance. Today we received a bill stating they forgot to charge for the exam. Is this allowed in?
Is it allowed? Anything is allowed, right? A dental office can bill for legitimate services because they did an exam, which is a legitimate service that was provided to you originally at the time, and possibly they did not charge, which was an oversight. Now they are asking for money. Whether timing matters, right? Well, are they asking you? And usually, like after several months, and they could still be asking. Several months later, 3 months, yeah, could be like a reasonable period of time. But there is no law that is going to prevent them from charging you because you did get a service and you probably signed a consent, and then you probably have some kind of a documentation that you or a contract that you signed with the dental office. They could be absolutely legally could be providing. You said there is no insurance involved because it is a self-pay. And insurance claims don't apply here. The office is essentially correcting their own mistake, and that's the reason why now they are charging you like after 3 months. But what you can do is, because you paid cash, and you can ask for a professional courtesy. Tell them, hey, it is not my mistake, and so you probably should have told me like at the time I came in, and you did not tell me. Most offices, are going to be courteous, and they are going to probably waive any charges, and particularly, definitely as a goodwill or a gesture. Particularly if you are going to go back, and then although they may not completely waive the fee off, they may say, what, we are going to give you. Why don't you pay us like whatever the money, like $100 or $200 that you may be owing them, but they are going to give it as a credit towards any kind of a future treatment. So the next step is, don't worry about it. Talk to your dentist. It is not unfair. Talk to them, and they definitely should be able to help you. Well, thank you guys. I think we have come to an end.
We have.
And thank you guys for being a great audience, and we definitely look forward to seeing you guys next time. Until next time.
Take care. Next time. Bye.
Bye all.